But the WHO did come out a couple of months ago saying that it was possible that it could be spread if that aerosol, that it dehydrated into a micro droplet and was spread that way. So there's all kinds of new things coming out as far as that goes. So even though some of this information may be different than what we found out in April, kind of keep that in mind. This is still, it seems like a long time because, we're talking about being on lockdown really since March. But still, since January, we're only 8 months in, and 8 months seems like a long time, but in virology, it really isn't. So it is spread through touching, it can be spread through touching a contaminated surface and then touching your eyes, nose, and mouth, although that's not really considered to be the primary way. And the way they know that is through contact tracing. So I don't know if you've heard of that, but like anytime somebody's positive, they go through who they've been in contact with and kind of trace it that way. And so they're not really finding a whole lot of unknowns where a person is positive and they don't have some contact with someone else who is also positive. So it is going to be mainly person-to-person contact. We were talking about the last time about it originating in bats, and primarily the horseshoe bat. And he's called the horseshoe bat because his snout looks like a horseshoe. But it didn't come straight from, I know in the very beginning people were talking about bat soup and things like that, but it didn't come straight from the bat. It originated in the bats, and they really do believe, because of the DNA, that it came through an intermediary called the pangolin. And in China, they used the scales, the dehydrated scales of this animal sort of for medicine. So they believe that is possibly the intermediary, but they're not even sure about that. There's, the research is kind of shaky on it. So we're not really sure about that. So I know last time I presented that there were 3 strains of coronavirus. And the only reason why I'm showing you this slide now is, last time we talked about how this had spread, across the world. And there's actually about 32 strains of this virus, and the United States, the CDC and the WHO are actually tracking 8 different infectious strains. So we've come a lot farther in identifying the different strains since the last time we met. So it's only been a little over 4 months, or a little less than 4 months since we met, and already 5 more infectious strains have been verified and are being tracked. So a lot of discovery in that part. Now, so the incubation period is still considered to be about 5 days, and it can appear within, symptoms can appear within 2 to 14 days of being exposed. The main symptoms are cough and a fever and shortness of breath. But the most common ones, cough, fever, fatigue, and shortness of breath. And then sometimes people will have headache, muscle pain, sore throat, anorexia or loss of appetite, loss of smell, the sense of smell, and chills. And then in rare cases, in some of the most serious cases, people can have nausea and vomiting, nasal congestion, and digestive issues and diarrhea. And about 20% of people who are infected with the SARS-CoV-2 virus will go on to develop a severe illness from that, mainly pneumonia, which can result in the respiratory failure. Now, that doesn't mean that 20% of the people are going to die. In fact, the mortality rate has been falling as the treatments have gotten better. We will talk a little bit about that, but I know that we covered this in one slide last time, and I did want to talk about this. So the percentage of cases that we have divided by race and who is more affected, which races are more affected. So the Hispanic population is severely affected. The African-American community, the Black community is affected. The white community is affected. But when you talk about the relationship between the percentage of cases and the percentage of the population that these particular groups make up, Black and Hispanic people are disproportionately affected by this illness, and a lot of it has to do with the disparity. So this is the percentage of cases, and this is the actual percentages of death. So even though more people who die are white, white people make up the larger portion of the population, so that's still not disproportionate. So Hispanics and Black people are more effective in their percentage of death related to the percentage of the population that they make up. If we move by age, this is the percentage of the cases outlined by age, and this is the percentage of the number of people who die in those age categories. So we do still see deaths among the gamut, but most of them are in our older age groups for the deaths. Everybody seems to be affected, but more of our older Americans are dying from the illness. Females actually seem to get this virus slightly more than males do, but males don't fare as well as the females do. And a lot of that has to do with the type of cells that men have in their testes, and it's cells that float all over their body. They produce a stronger amount, a larger amount of a particular type of hormone that is affected. So typically with the clinical course of this illness, people, if they have a mild case, they'll suffer for about 2 weeks with flu-like symptoms, 3 to 4 weeks if it's a more severe case, 4 to 6 weeks for critical cases. And I'm going to show you some numbers in a few minutes. But when you're talking about recovering from this illness, so I'm going to show you the number of people who have recovered. Most people do recover. The problem with this illness, with SARS-CoV and COVID-19, is that it causes your blood to become very sticky. Some of you guys might have even seen some of the social media posts, which I find very annoying, with all of the people who graduated from Facebook U shouting out all of those scientific facts that they really don't know anything about. And they'll say, oh, my uncle died from a heart attack and they called it COVID. He was positive for COVID. He died of a heart attack. My grandmother was positive for COVID and died from a stroke, and they still called it COVID. Well, one of the side effects, or the, what do you call it? I'm losing the word. It's not a side effect, but it's a detrimental effect that the virus has on the body, is it's causing the blood to become very sticky and very thick. And when that happens, it does cause occlusions in your arteries. So just like a heart attack is, when you have plaque build up in your arteries, your platelets stick to that plaque and can occlude the artery and cause heart attacks and strokes. So likewise with the coronavirus, that's exactly what's happening. This blood is getting very sticky, and then it sticks to the plaque that's already there and causing heart attacks and strokes and lung damage. There has been 7. For our group, I showed a picture of the lungs. I didn't do that for you guys on purpose because it's very graphic. But the outside of the lungs taken from people. So we've done 7 transplants worldwide on people who have recovered from COVID, but their lung tissue was completely destroyed. So even though people are recovering from the illness, they're getting pancreatitis, they're getting diabetes for the first time, they're going into kidney failure because of the scarring that it's creating. So there's little clots being thrown into the glomeruli in the kidneys, and it's causing scarring in the lung tissue that is causing people to have to be transplanted. The outside of those lungs look like Swiss cheese. So it's very, it's terrible. It's terrible illness. So even though we've all kind of become very used to dealing with this virus over the last 4 or 5 months of lockdown, you do want to make sure that you're still practicing good prevention techniques and not becoming complacent. So make sure you're washing your hands often, covering your cough when you cough or sneeze, cleaning high-touch surface areas, avoid touching your face. If you go out, I know some of us are venturing out. It does seem like the governor has extended phase 2 up until September 11th. We don't really know what's going to happen after that. But if you go into an area, I know that my father-in-law died last week, the week before that, and we ended up having the funeral, and it was supposed to be a really small graveside service, but a lot of people actually came. There was about 50 people, and they didn't think twice about coming up to you and hugging you, even though people did have masks on. We're we're getting a little complacent, I think, as a population. And I think that's part of the reason why we have not seen the decline in cases that most countries have seen, is people are ignoring this advice. So you do want to still avoid visitors. Stay at home if you can. Keep your distance from other people. So if you have to go out, make sure that you're keeping your distance. If you come in, make sure you're doing that washing of your clothes. You know, just go ahead and take off your clothes and put them in the washing machine. Don't shake them out when you get home. Just wash. And if you feel like you're getting any kind of symptoms whatsoever, call your doctor and get help for that. There's a lot of different treatments that have come out since we last met in April. There's plenty of them that are on the forefront, but the ones I wanted to really highlight is Moderna and remdesivir. So remdesivir is a treatment that is helping with the inflammatory response. So a lot of the detrimental effects of the virus itself is because the body kind of goes into hyperdrive on the immune system and causes a major immune response. So this remdesivir does help with that. And Moderna is a new vaccine that actually is going into broad scale clinical trial right now. So we're hoping that a vaccine will be available in early 2021. But UNC is actually involved in both of these studies with the remdesivir and with the Moderna mRNA 1273 vaccine trial. So they're doing a broad scale enrollment of about 30,000 people to take this experimental vaccine. And I want to highlight that one of the major things that makes this very exciting for us is that, you know, we try our best to transplant, utilize organs for transplant. That's our main goal with every donor. But if organs cannot be transplanted, or if they're not transplantable, we attempt to allocate every donor that the family has authorized research authorization with a research company, a research program. And the majority of our lungs that are non-transplantable go to the UNC research lab for cystic fibrosis. However, during this COVID crisis, they take the cells out of the lungs themselves and grow them so that they have cell lines to study cystic fibrosis. But they distribute these cells worldwide. And during this COVID crisis, they have been distributing these cells worldwide. So our donors, our research lung donors, have been directly involved in the direct fight against COVID-19 through participating in these studies with the remdesivir and the Moderna vaccine. In fact, the Moderna vaccine has been proven effective with these lung cells from our donors as the remdesivir has. So we're able to move into those clinical trials. And I'm really excited about that our donors have been able to help fight against this illness. So this is kind of where we were. So I presented on April 27th last time. And so I don't know if you can see all of these little countries. So there was 185 countries affected at the time. And I'm not sure I updated that particular number, but you can see the countries that are blank here. The blue ones are the ones that were affected. So we were a little over 2 million cases worldwide last time. And so now we're at 188 countries affected. So only these little yellow countries now remain, and we're at 19 million cases worldwide with 729,000 deaths. Now, if we go back, you'll see that the mortality rate, we had 206,000 deaths. The mortality rate was about 6.9% then. And so the mortality rate is about half that now, which is really good, even though the deaths are higher and the cases are higher. So we do have about 12 million people that have recovered, but I use the term recovered really loosely because we don't know how many long-term effects they're going to have from having their infection to begin with. When we last presented, we had about 928,000 confirmed cases in the United States and 52,000 deaths with a mortality rate of 5.7%. And now we have over 5 million cases in the United States with a mortality rate of 3.2%, so 162,912 deaths. So I know sometimes we get kind of boggled down with numbers and we don't really think about how much that is. But if you think about what you guys are aiming for with, that's more than the number of people we have on our waiting list right now. So you guys are trying to help educate to get organs for people, for all of those people on the waiting list. We have a staff of about 125 people. So all of our jobs are trying to save that, a little over, what is it right now, 114,000, a little over 114,000. So we've had more deaths in the United States than our entire waiting list. So it is a lot of people. I forgot to change the date on that. This was actually from today. I apologize for that. This is what the North Carolina looked like the last time we reported. So we had about 8,000 cases last time, with 94 counties affected, with about 451 people hospitalized and 325 deaths, with a mortality rate of 3.4%. And I had highlighted our top 10 cases, states or counties with cases. And so this is, as of today, we had 136,218 cases, with 2,168 deaths, 1,109 people hospitalized, with a mortality rate of 1.6%. So we actually have more people, our top 10, but Charlotte is most harshly affected, with 22,000 people in that area alone. So a lot of people in North Carolina too. We're a hot zone. So this is what our curve looks like for North Carolina cases. Our peak number of new cases was 2,481 new cases in one single day, and that was on the 18th of July. So we're not really going in the right direction. The hospitalizations, well, I'll go back to that slide one more time. So this yellow line is the 7-day trend line. So it does look like we've come down from the 18th, but we're not, about a month out. So we do hope that this continues to trend down. But we have had a couple of dips in here since then. So let's hope that we're headed in the right direction. Our hospitalizations have stayed pretty stable. Our peak was 1,236 people in one day on the 28th of July. So we're not really too far from that number. The goal with social distancing was to keep the hospitalization. So, a lot of times people think it's to keep people from getting infected, and that of course is a goal, but we do know that this illness is going to spread, and it's going to spread until we reach herd immunity, and we can't reach herd immunity without a vaccine, or without, at least 45% of the population getting infected and developing antibodies. So that was not the purpose of social distancing. The social distancing was to keep the hospitalization rate low, because we do know people are going to catch the illness, even with the social distancing. But we're trying to make sure that we have enough resources in our hospitals to handle the load of patients. And I don't have a picture of the map, but there is a coalition that was actually put into place it's a bioterrorism grant back when 9/11 happened, so that if one particular hospital has an overload of patients, there's a network of hospitals who can take transfers of those patients, so that we don't overload our hospitals like Italy saw. So, that was the biggest problem in Italy, was that everybody got sick at one time and the hospitals got overrun. And sort of like New York, I don't know if you know, but New York was transferring a lot of patients out of New York. But the hospitals got overrun there, and that's why a lot of people were died. But in Italy, they were actually sending people back home to die. There was no place for them to go. And we don't want that to happen in the United States. So that is the reason why we've done the social distancing thing. Back in April, we were doubling every 15 days when I presented. And so now we're at a case rate, we're doubling every 38 days. So it is a little bit slower than it was in the beginning. So, some of these practices we put into place are working. So I know it can be frustrating. I did have this graphic last time, but it doesn't mean we should get complacent and stop that. I mean, the whole reason of doing it is to slow down that curve and to flatten out that curve, and we're not where we need to be yet. So especially with masks, I know that I see it on social media and it's so annoying. People will say, you look stupid, I'm not wearing one, blah, 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 But this is what it looks like. These are the countries that did not put in mask policies or don't have strict adherence to mask policies. And these are the countries that do enforce the use of mask 100% of the time. So if you use mask, it is better. And this is just going to show you the probability of a contagion spread, so that if nobody is wearing mask, if this person is infected, there's a very high risk. There's still a high risk if you have the infected person splattering out molecules. But if they wear a mask, they are stopping some of it, not all of it. So that's a medium risk. But if both people are wearing masks, it goes to a low risk. If you stay 6 feet apart, it's very low. And if you stay at home and don't have any contact with anybody who's infected, then you don't have any risk. The CDC is saying that it's not going to come in on your Amazon packages. I do know people who are leaving their Amazon packages in the garage or on the porch for a day because they feel like UVC is going to kill it, and UVC will kill it, but that doesn't make it through our atmosphere. So UVC they use in the hospitals to sterilize instruments, but so it would be very rare that something would be spread on a package. So I imagine if your handler had it, sneezed on your box, and you immediately touched it, that you could get it through the droplets that still are not dry on it. But other than that, you don't have to be too fearful of packages or groceries or things like that coming into your house. As far as CDS's path forward, COVID-19 is a rule out if somebody is actively infected with COVID-19. But people are recovering from this. We've got 12 million people worldwide that have recovered from this illness. And so we have to look at some point, most people are going to have had this illness at some point. So we can't rule out everybody as an organ donor. So if a patient has recovered from COVID-19 and has 2 negative tests back to back, and they are 28 days past that negative test, that second negative test, they will then again be eligible for organ donation. We are testing all of our organ donors twice. So they get tested 2 times. And if they've already been tested, we want them tested within 48 hours of going to the operating room. So we're testing them ×2 in the hospital, even if they've already been tested. Our staff is working remotely as much as possible, and the health of our staff is being monitored. So anytime we're activated to go to the hospital, we're required to take our temperature before we leave our house. If we're coming into the CDS office, we have to take our temperature again when we get to the office. We're wearing masks all the whole time that we're in the office, unless we're isolated in a room that has nobody in it. We're cleaning our rooms, our offices more often, and with sterilization techniques. And when we go on site to the hospitals, most of the hospitals are taking temperatures as we come in, and we're wearing our mask 100% of the time that we're in the hospitals too. So we're doing the best that we can to keep our staff and the patients that we serve healthy. So I know that was a lot of information at one time, but I want to open it